Ready to start? You all excited? Pumped up to be here?
Woo!
It's a nice
We're excited
Saturday.
for the sunshine.
Yeah. How many of you came just for the cookies? Just Stephanie, I guess. Seems like an appropriate time of year to talk about falls and balance, fall prevention stuff, especially with this winter. Man, we've got a lot of snow. Should we put them over here, Steph?
Nice.
Have a chair over here. Like I said, it seems like a very appropriate time. Obviously, we got a great day today. But yeah, a lot of ice left right now. So, falls are one of those things that we see a lot of at the clinic. At the clinic, and it's one of those things where if it hasn't affected you, it's probably affected someone you know, and it may be affecting someone that you know more than you think it is too. So. We're going to cover a lot of ground today in terms of what causes falls, what contributes to it, and what you can do about it, basically. There's a lot of factors, and I'm going to kind of break it down for you and make it hopefully make sense, and then give you some ideas on what you can do about it. But first, if you don't mind a little interaction here, how many people in here have fallen in the past?
Oh yes.
Oh boy.
Everybody.
This is like those weddings where you say, "How long have you been married?" Raise your hand if you've been married for a year, and then. So, how many people have fallen like in the last year, roughly? Okay, last 6 months. Okay, last 3 months. Okay, yeah. Steph, have you fallen too this week? Oh no. Okay.
Oh no.
So yeah, obviously it's a big problem. The bigger problem in my mind, obviously when you fall, there's the immediate danger of like an injury. Mm-hmm. The bigger problem in my mind is what happens after that. Because for those of you who have fallen and you're getting maybe a little less mobile, do you notice you're starting to miss out on certain activities at times? So throw out some activities that this could impact. Just shout them out.
Evening activities.
Evening activities?
Yeah, especially if it's cold or icy.
So like low light, you mean?
Right,
or just anything in the evening?
Yeah, I have an evening meeting that I go to once a week, and boy, if roads aren't good and the ice is on the road or even on the sidewalk, I don't know.
I just stay home.
I know, I'm getting an old lady.
So evening outings. That's a big one. Okay, who else has some stuff? Shopping?
Shopping?
You didn't have to give me anything. Shopping. Okay, yeah, shopping at the store. Probably the mall too. That may not affect the men quite as much as the women, but I shouldn't make those kind of remarks.
Even grocery, I come to grocery.
Yeah.
Do I look like I'm buying one at the mall?
Going to work.
Going to work.
Yeah.
Work.
A lot of good days, man.
Stephanie tries to call in that one all the time.
Weekly.
Can you guys see that okay?
Yeah.
Okay, so work. What else?
Just moving trash cans out.
Yeah.
So just like simple stuff around the house.
Checking the mail, that's when I fell.
Getting them
Trash, mail.
Yeah, especially if the snow isn't cleared away at the mailbox or at the trash bin.
You can't take your garbage.
Trash, getting the mail. What did you have there, Carol?
Cleaning.
Cleaning? Yeah. And what's the issue with cleaning? Is it mainly that you feel unsteady, or is that it's just too tiring?
The
Tiring.
vacuuming, I can't,
Oh, yeah.
Vacuuming
but it's not all because of falls, it's because of the hip.
of the hip.
Yeah.
That's a good point too, because a lot of times falls stuff, they don't really ever stand alone. It's usually like you've got another issue, and it could be a muscular issue, it could be a previous fracture, it could be more neurological. A lot of MS in Spokane. Parkinson's is pretty common these days. And what you're going to discover today too is that falls and balance in general are multifactorial. There's so many things that can contribute to it. And so it comes down to what can you do about it, and what's affecting your balance and your falls. Because chances are everyone in the room who has issues with falls and balance has some similarities, but you've also got some differences too. So you can't treat everyone the same. Any other big activities? Go ahead, Susie.
Well, I was just kind of wondering if some other maladies might affect falling, like I have arthritis.
Yeah.
So maybe I don't pick up my feet like I should, and I don't pay attention to walking. I never used to pay attention to walking.
Yeah.
Now I pay attention to walking.
Yeah, it could be
Because
your knees.
little buckles
it could
in
be
the
your,
sidewalk.
Could be your knees, knee pain, hip pain. Anybody have back pain? No one has back pain, right?
Yeah.
Oh,
Right.
okay. Yeah, so pain. And then how many of you like to go out with your friends and stuff?
Oh, yeah.
You know, or go out to dinner?
Yeah.
You know, once in a while I get people who like to go out dancing, you know, do stuff like that.
Oh, that's a far memory.
Yeah. Any golfers in the room today? Any golfers? Okay. Yeah, look at that.
Golfers.
Racquetball, tennis, any of your sports and stuff.
Oh,
Yeah, so obviously, I mean, we could go on and on with the list here, but there's a big impact there. And what happens too, I kind of call this the downward spiral of having bad balance. So let's say that you're not too steady on your feet and you're starting to notice some limitations with all these activities. Then you have a fall. So you have a fall, right? You've got bad balance. So you got decreased balance. And then you have a fall. And psychologically, what happens when you have a fall?
You stiffen up even more,
Yeah.
Yeah.
because you get more
Yeah.
afraid of that fall.
And the big 4-letter F word.
Fear.
Fear.
Yes.
Nice. I was hoping someone would say fear. Okay, so this all leads to fear.
That's not what I say if I fell.
Yeah, you may say it as you fall.
Yeah.
But fear is the big one, right?
Absolutely.
Fear is going to lead. What do you think happens when you're fearful?
You go slow and
Yeah.
You don't do things as much.
You don't do
people
things.
ask if you need some help.
Yeah. So the fear is going to lead to inactivity.
Yeah, that's much more.
The inactivity is going to lead to more weakness,
Yeah.
right?
Right.
Less balance. That's just going to come full circle.
Fat.
That's going to come.
You're not.
Weight gain. Okay, weight gain can happen too.
Yeah.
Doesn't help.
Weight
Um,
gain,
But the inactivity is going to lead to more decrease in your balance, right?
Right. Yeah.
And then eventually, as you're kind of spiraling here, oh, I got it. The big thing that, again, in my mind, that you get to is you get a decrease. Let's call it QOL, quality of life.
Right.
Quality of life.
It's a vicious cycle, isn't it?
It is, and along with that, you're going to start experiencing things like anxiety, depression, you know, feelings of isolation. And, you know, so it's very easy for us as physical therapists to look at you and evaluate you and say, okay, we can evaluate your physical being, we can see what's going on with you, we can help you. But we also realize that this is what's really at stake. I mean, we try to be objective, scientific type people, but really this is what's really at stake. Because if you can no longer do those certain activities, you can no longer go up and down your own stairs at home. For a lot of people, one of the biggest fears is losing their independence. And saying, well, right now, maybe you rely on a spouse or a friend or, you know, a child. But for some people, they don't have that option. So what's their next step? No one say it, right? The nursing home. And to some people, that's okay. And some people, that's not okay. So that's why we're talking about balance. Kind of a long-winded introduction. But that's why I feel like it's so important. And again, even if you haven't gotten to that point, hopefully with the workshop you'll kind of see that this stuff happens and it comes. And that's the other thing, is if you can project yourself into the future. We do this a lot with our patients. Say, okay, well, if we can achieve this, you know, these goals now, make you stronger, more balanced, more confident, how's that going to improve your quality of life? And on the flip side, if we don't do this, what's your life going to look like in 6 months? Because this stuff gets out of hand really fast. What's it going to look like in 12 months? You know, what's it going to look like when you fall again? And again, potentially every fall is a real danger in and of itself. You fall and you break a hip. What's that look like? Ugh.
That's
Yeah.
gonna be
Anyways,
awful.
so just start off the presentation with my scare tactics here. So now you're all ready to absorb the information. So good. So first thing we're going to cover then is the 3 balance systems. For those of you who have been in before or read some of my blogs or videos, you may be familiar with it, but we're going to go a little more in depth. After that, I'm going to talk to you about other factors that contribute to balance outside of just the 3 systems. And I'll probably spend a little time on vertigo too. Does anyone here have vertigo?
Oh, yes.
Okay,
Yeah,
cool.
I have heard of it.
Okay, I was just going to float it out there, because if no one has vertigo, I'm not going to spend any time on it. But yeah, I'll spend a little time on vertigo too. And then,
It's no fun.
no, vertigo's pretty, yeah, it's pretty icky.
Awful.
Yeah, but a lot of times it's very treatable, so that's good too.
Mm-hmm.
So let's get into the 3 balance systems. And again, yeah, we're going to go through all of that. I'll have time for question and answer at the end. And if you have questions as we go, just shout them out, okay?
Okay.
So you mentioned nighttime activities, right, Susie?
Mm-hmm.
So your first balance system then is your vision.
That's what I was thinking.
As you get older,
And that is really true. Because,
Yeah.
you know, I sing, and the minute he asks us to sing with our eyes closed,
yeah,
Yeah.
I can't do that. I have to hang on to something.
yeah. What
Yeah.
that tells you, and we see this a lot, is that you're pretty much visually dominant for your balance, which means the other two systems, which I'm going to lay out, aren't as strong as they should be.
Mm.
And that's something that you can usually do something about depending on your underlying diagnosis. A lot of people are reliant on their vision. If you think about your vision and you're, in a well-lit room like this, every time your body and your head moves, everything in your environment moves with it or opposite of it. And it's very quick input to your brain saying, okay, we're moving, or we're not moving. So vision is a very strong portion of your balance. You just don't want it to be the only portion of your balance. This is why anyone have a hard time walking in a dark room or at
Yeah.
night, like in a
Yeah.
dark parking
Oh,
lot.
yeah, dark flashlight.
Yeah, because when the light goes down, your vision is much less accurate. So now you're saying, okay, well, you can't rely on this one so heavily. You've got to kick in the other two. If the other two aren't all that strong, or if you've got some of the other factors that we're going to discuss afterwards, that you really notice it. Or like you said, if you close your eyes, you're like, whoa. So that's a visually dominant person. Go ahead, Jean.
You helped me with that so much about 4 years ago that now whenever it comes and okay, what did Luke say? Oh yeah,
Good.
practice this and that. And your methods for these things are really helpful.
Good, thank you.
Yeah.
Checks in the mail. Yeah, and that's a point I'm going to make as we go along too. Most of the stuff is very treatable. It really is. You just have to know what you're dealing with and what you can change. Doesn't mean you can change everything. Can you change the fact that you have, advanced arthritis in your knees? Not necessarily. But can you change the fact that that's led to weakness and other issues with these three systems? Yeah. Yeah. It's not easy.
I was just gonna say too, something else as far as the vision is concerned, the director wants us to sing on risers
Yeah.
Oh, dear.
with our eyes closed.
Yeah.
Oh, dear.
You got to work on these next two systems. Okay, so the next two, the second system then, I'm just going to call it, simplify it here, let's call it sensation. Now, for those of you with neuropathy, this may not be your strong suit. So sensation, basically, sensation in your feet. You also have sensation throughout like the joints and muscles in your body that tell your brain like where your joint positions are. We've got a really fancy name for that you don't need to know. It's proprioception. But the biggest one that we see a lot of is sensation on the feet. Because when you're standing on your feet, as you shift your weight, with normal sensation, you can feel your weight shifting. So again, input to your brain saying, oh, you're standing on your heels. If you want to realign your balance, come to the middle. So again, if you've got neuropathy, not a whole lot you can do about that. But even if you have some sensation, you can usually improve that one. Does that one make sense to people?
Yes.
And again, so like my body knows that my knees are bent. It can sense the pressure in my knees change. And in my ankles, things like that. So that's a
Does
second.
neuropathy mean you can't feel something? Is that what the word means?
Neuropathy is kind of a general term for nerve issues, and the most typical one is going to be neuropathy in your hands and your feet.
Okay.
For
Like
some
my brother has
people,
diabetes, and he says,
diabetic
Yeah.
neuropathy.
yeah.
Yeah, that's like small blood vessel damage. So you end up those small blood vessels that supply nutrition to your nerves.
So the nerves aren't working then? Is
They're
that
not
what you're
working
saying?
properly.
And there's really not a lot you can do about that.
And it hurts.
Yeah, so for some
Oh, it
people it might just be
hurts.
mild numbness and tingling. You might still have your sensation intact, and that's good. For some people it gets to really be painful. Eventually
Yeah,
for
it
some
kinda
it's just numbness.
Yeah, and my chemotherapy treatments made it worse.
Yeah. Oh, for sure. Yeah.
Mm-hmm.
Yes. Okay, so that's your second system. Your third system then is your inner ear.
There's your vertigo.
There's your vertigo. And more commonly than vertigo, positional vertigo at least,
Can
more
I ask-
commonly the inner ear just isn't working that well. Go ahead, Carol.
Can I ask a question on the sensation? Okay, when you have neuropathy in your feet and you're numb and you don't feel, I feel like I'm walking on blocks most of the time.
Yeah.
Doesn't that affect with the vision then too? Because like when you close your eyes,
Mm-hmm.
you don't have that feeling that you have otherwise. You
Yeah,
know
so
what I mean?
so for you, without sensation in your feet, if you cross off balance system 2, and then you close your eyes and cross off 1, you're going to have to rely on 3.
Oh boy.
And the most common thing we'll see, and probably anyone in this room, is that number 3 is not working very well. It's not working very well at all.
I know when I caught this cold, it's much better now, but I just every once in a while, I just caught myself.
Yeah,
Going off
feel a
balance.
little unsteady, a little
Yeah.
off balance.
Yeah.
Yeah, so again, the inner ear is basically giving your brain input as to where your head is in relationship to gravity. So when you bend to the side, or you turn your head,
Or bend
that's giving,
over.
or move, anything that ends up moving your head is gonna give your brain input because of the inner ear. The main thing that you see there, which I'm gonna cover with a little later with vertigo, is that you have fluid inside your ears. Does that sound familiar to people? Okay, so you have fluid in these canals. You don't remember spinning around real fast when they were a kid?
Oh, yeah.
Okay, you spin around real fast, right? My kids do all the time. And then you stop, and the room's still moving, right?
Yeah.
That's because when you spun around, you got that fluid in your inner ear going around real fast. And when you stopped, the fluid usually stops when you stop, but it didn't stop because you were spinning so fast. So what happens with your brain is, everything else, so like if I do that real quick, and I stop, my vision is telling my brain that I've stopped, my sensation is telling my brain that I've stopped, and my inner ear is telling my brain that I'm still going. So your brain freaks out, and it goes like this.
Yeah.
And that's more or less vertigo. But we'll cover the actual, there's more of a cause of vertigo than that, but that's your inner ear.
So is that sometimes when you get up really fast?
Can be, a lot of times that's blood pressure too. That's usually blood pressure. But
Because
most
it
times
just
you're
takes
gonna
a second, like 10 seconds or whatever. to
Yeah.
straighten that.
You'll notice this a lot, like if you're driving, you turn your head real fast and you get a little wave. Or you just look real fast at something, or you go to pick something up and whip your head back up and you get like a wave of that. But that's not, it's different than lightheadedness though. Lightheaded is just like, whoa, like the room kind of started to close in on you. This is more of a sensation of movement. And that's what vertigo truly is a sensation that the room is moving. So some people will say, oh yeah, that's, you know, when I drank too much that one day in college. The spins, that's
Right.
vertigo. The room is spinning. You're pretty sure you're not spinning with it, but again, your inner ear says you are. And your vision and your sensation says you aren't. And again, so when these 3 systems don't agree, that's when you get problems. The most common problem we see people without like vertigo is that they're just so reliant on the first one. And number 3 isn't very good. And then next up, we're going to get into some different factors that also kind of compound the issue. But if you look at the inner ear, like anything in your body, you know, the old move it or lose it type thing, or your muscles. You either work them and keep them strong, or you don't and they get weaker. That's exactly how your inner ear is. It's not a muscle, it's more of a reflex with your brain, but it's the same thing. So when you get into that spiral of a fall leads to inactivity, leads to fear, the inactivity makes this system much less sensitive because you're no longer using it that often. You're no longer challenging it, you know, so you're no longer moving a lot or doing like some dance movements or whatever it was that you were doing to stay active, and it just gets weak. That's good news for most of you though, because when it gets weak, you can typically strengthen it. All right. Any questions on these before I wipe them clear? Okay. Cool, cool. We can always come back to it.
Think about inner ear. I can't hear what he said.
So we're not signing up for Dancing with the Stars up for the new year?
No.
Might have to be a question.
No. But you can sing to us later, Susie. That'll be all right.
Oh, God.
Okay.
I'm glad you're on this side of me.
Oh. So let's see here. What else do you guys think impacts balance? You've kind of already mentioned it. Pain,
Oh, yeah.
you know,
Yeah.
that can impact balance kind of indirectly. Mostly what you see with pain is that it leads to weakness. Okay, so you're going to deal, all these are just other factors. They're not balance systems per se, how we kind of categorize things. Because, you know, we like to put things in nice little boxes in our world so that it makes sense to us. So you get weakness. Can people see this okay, by the way?
Yeah.
Okay. So you get weakness. That's not going to be good for your balance, right? Because if you start to get off balance and you're expecting your muscles to pull you back into alignment, if they're not that strong, it's not going to happen. Weakness goes hand in hand with, you know, decreased endurance. So you've been walking for a little while in the store, and now your muscles are tired. Do you think they're going to kick in when you start to go over? Not
No,
really.
no.
Not really. So that's a big one. Let's see. Those kind of all go hand in hand. Flexibility is another one that's kind of more of a of a body type one, you know, more of muscles and bones, flexibility.
You know, you talk about this like it's all muscles and stuff like that, but there's a psychological part of this that I see.
Sure.
Especially when you're talking about the falling part of it. I mean, say, well, I just don't think I'm gonna dump the garbage right now because it's icy outside, so I'm not gonna do that. So then that sort of leads down this path. But then you've got to rationalize it, I think, and say, okay, put on your boots, put on your coat,
Talk yourself into it.
talk yourself into it, right? And then, but that's conquering of the fear, but that's the psychological part of it, isn't it? Or is there a
Oh
psychological?
yeah, that's kind of why we started with that at the beginning, because everything
Yeah.
goes back to that.
Because
if
I
you're
can
fearful
talk
of
myself,
falling
okay,
or-
there's an icy sidewalk, I'm walking the dog is pulling me, I have my stick. Okay, fine, just take a look at it and walk.
Yeah, yeah.
But you do have to think about it.
Yeah, exactly. And don't let me think that I'm encouraging you all to do things that aren't safe, because that's about the exact opposite of what you should do. Because if you legitimately have a fear of walking on the ice with your dog, that's probably a healthy fear. You know, because again, in and of itself, a fall can be devastating.
Absolutely.
Especially
But
when
it's
you have trouble
equally as-
getting up and nobody's there with the dog.
It's equally as devastating in the long run when you avoid all of your activities, because then you just go
Right,
up that
but I find that I
cascade.
do talk myself into stuff.
Okay, talk into some safer stuff, maybe. But you know, it's good.
You gonna dump the garbage for me?
You're like, yeah, exactly. Yeah, yeah. So these are big ones that you see that's going to impact your balance as well. A really common one these days, one of my absolute favorites, is, oh, that doesn't work very well, but I wanted to put it in red, so we'll go with it. Medication.
Oh, right.
Yeah.
That's a big factor.
My favorite. I think they say the average person 65 and older is on like a dozen medications, with how many side effects and interactions that you just can't really predict, and everyone's personal chemistry is a little different. But the most common side effects with most medications is like dizziness and lightheadedness, you know, and sometimes there's more serious side effects too, but definitely can have an impact on your balance. Blood pressure
Absolutely.
issues, stuff like that.
I get so tired of going to the doctor and well, let's try this, you know.
Right, right.
Yeah.
You know, I just, no, I don't want that.
Yeah.
He
That's
tried
a
to
whole-
put me on prednisone when I got this cold, and no, I'm not taking prednisone.
No,
No,
thank
you
you.
got bronchitis.
Yeah.
Bronchitis is different than a cold.
That'll be another workshop.
Oh,
I'll drag
stress.
I'll drag a naturopath in here.
There we
They
go.
can talk to you guys about natural things. And don't get me wrong, I'm not saying all medications are bad. I'm just saying that medications have they can have a really strong impact on your balance, especially if you're on some of those ones that maybe are playing with your blood pressure a little bit and have the side effects of dizziness and lightheadedness. Okay, and then Susie, again, we're going to get back to some of what you said. Pain is a big factor of your balance too. And again, that's mostly just a factor because it's going to lead into that downward spiral of I hurt, so I can't do this. You know, I don't want to walk that far. I don't want to do this activity. Now you're a little less active. You're a little weaker. You still hurt just as bad, probably worse as you get weaker. And again, there's so many ways. I hate to make it sound so doom and gloom, but there's so many ways just to slide right into that spiral. And it just, so again, you always come back to, well, what can you do about it, you know? And if you say, well, I'm in pain and I can't exercise, is a good indication to say, well, what can you do to keep your muscles strong then? If you can't do the exercise you're used to, what can you do, you know? So, okay, so those are a lot of other factors that are involved. The last one that I want to mention there is your brain. Everyone's got one, right?
I don't know.
I'd
hope so.
Doesn't work so well
Some of us have
sometimes.
two split personalities.
I like that one.
So your brain's ability to process all of this input is a big factor. And again, the most common ones you're going to see around here are like multiple sclerosis, MS, and Parkinson's. You know, you start getting things like Alzheimer's and stuff like that. If you've had a stroke, something like that, again, all those things can impact your brain's ability to process the information. So even if you have pretty good vision and sensation and a good inner ear, if your brain can't make sense of it, that's obviously going to be a big barrier. That's something that with, you know, treatment-wise, you don't tend to do a lot about that. what you do instead of trying to improve your brain at that point is you try to develop strategies just to assist it. It's kind of like saying, you're going to use a walker because a walker is safer, and then you're going to work on things you can control. But again, hopefully you guys can see by now that any one of you may have 2 or 3 big factors that are affecting your balance that are maybe not the same as the other person sitting next to you. So it really comes down to knowing what you're dealing with.
Luke,
Yeah.
I see older people sometimes, and I'm not a puzzle person, but they're doing crossword puzzles and they're doing that kind of puzzles and
Yeah.
Sudoku.
Sudoku
Is
and
that
stuff.
a brain development? Does that help too?
They,
Keeps your brain
they
sharp?
have pretty good research on that stuff. Just saying, keep yourself mentally stimulated. Yeah, I think stuff like you do too, singing. And I'm a big fan of like community events. If you engage with like-minded people at events, say you work for a similar charity or you go to the same church together, and you organize potlucks and you organize things like that. Anything that keeps you mentally stimulated, I think there's pretty good research out there. And that stuff, and reading, and that stuff goes, to me, that goes directly towards your quality of life too. Because if you're doing those activities,
Right.
you have that sense of well-being, the sense of belonging, you're feeling good about yourself, So yeah, brain's a big one though. Okay, people want to talk about vertigo real quick?
Yes.
Yeah.
Vertigo! What is vertigo?
Go to get out of bed and realize that you do that.
Okay, why can't you do it?
Because you are spinning like everything.
Okay, now, Carol, are you spinning or is the room spinning?
The room is spinning.
The room is spinning. Okay.
Yeah.
Is anybody else spinning or is the room spinning? Could go either way.
It's usually my head.
Usually you feel like your head is
Dizzy.
Yeah.
I have
Dizzy?
to like focus or close my eyes for a minute
center
Yeah,
yourself.
You have to lay real still because if you move your head, then you feel that again, even with eyes closed. But
Okay.
Right, and I get real nauseous, feel like
Yeah.
I'm gonna vomit.
Oh yeah.
Yeah, it's just terrible.
Yeah. You get that right now?
No, not right now, but
No, like recently though?
my latest one has been every time I bend over,
Okay.
and then I pat. Whoa!
Okay.
But the room or me, it's not spinning though. But I'm thinking
But you're
maybe,
real,
yeah, a little unstable. And I
little
think
swimmy. Yeah.
that's
Just go with it, it's fine.
blood. No, because it makes me feel just awful, and I'm like, oh my gosh, I feel like I'm gonna vomit.
Yeah. Yeah.
And
So
I
the
don't know
spinning.
if it's vertigo or if I'm having a hard time with my blood pressure or
Mhm.
what.
Similar for you, Gloria?
So
With the vertigo, my biggest thing is I gotta find a place to sit down.
Okay. Just to
If
feel
I don't
stable.
get set down, I'll fall.
Do you
Yeah.
feel unsteady or do you feel like the environment in the room is moving?
Oh, room.
The room is moving. Okay. So true vertigo is the sensation of spinning. And usually it feels like the room is spinning. Other similar but not quite the same things, you can get dizziness, you can get lightheadedness, and you can get unsteadiness. So they're similar but not quite the same. So we get a lot of people who say that third balance system in their ear isn't very well tuned. They just feel unsteady, and it feels a little more like they're unsteady up top. And they may feel unsteady down low too. I try to break it out with people.
What can you do with that? I mean, what can you do with that?
I'll tell you about it here in just a minute. But yeah, so you break it out. They feel a little unsteady on their head. It's almost like a little bit like you're on a boat.
Oh,
You ever have that?
seasick.
Yeah.
You're like, when you get off the boat, you feel like you're still kind of moving.
Yeah.
Like, ooh, that's not right. So that's a little different than vertigo, where you say the room is spinning. It's not spinning. It just doesn't feel like it's staying put. So it's a little different. It's different than being lightheaded, where you just feel like you're gonna maybe go down. That's a little different sensation. And again, more of the unsteadiness can be in the legs too. Like I have a gal now, I said, well, it's very hard for me to ferret out what she's actually telling me. Do you feel unsteady with your brain, or do you feel unsteady with your body? And for her, it's both. That's the fun thing about this stuff. You say, well, which one do I have? Yeah, which one do you have? Well, you have 3. You're weak here, your inner ear isn't working well, and you've got some other issues with medications or whatever. So that's, again, long-winded, but that's vertigo. Vertigo is the sensation of spinning. Karen, yours sounds more positional. For a lot of people, that's positional. So there's
Oh, sure.
positional vertigo. We call that BPPV. PV.
Alrighty then.
$10 to anyone who knows what it means.
What does it mean?
Blood pressure,
No, it's actually, you don't need to know it actually. The last two, it's positional vertigo. Positional vertigo. That's all you need to know
Is
that.
that
You can Google it later,
I
but
know.
it sounds like yours is positional. So that type of vertigo is mostly related to your inner ear. Not
Okay.
mostly, it's related to your inner ear. Okay, so let's go back to those canals. You've got, and I've never tried to draw this before, so you guys are gonna have to bear with me on this. I should have practiced before you all got here. You've got, so let's go 3 canals. Where's the other one? The other one is down here.
And that's inside your ear.
Each ear, these are very small structures, okay? So you've got this top canal, it's gonna be oriented in this plane of movement. Do I look like an airline flight attendant? Okay, right here. These are your top canals. You've got the canals back here that are oriented in this plane of movement. Okay, no one's gonna wave back, all right? And then you've got the bottom canals, which are oriented in this plane of movement. So those are those canals that have fluid in them. So again, you move your head in this plane, these canals are swishing the fluid.
oh,
You move your
okay.
head in this
They all
plane.
three have fluid in
They
them,
all
right?
3 have
And
fluid in
so
them.
what's the job of this inner ear then is to figure out how these balance so that you don't
Yes.
fall over, is that what you're saying?
Yeah, and so on each inner ear, the fluid is going to be either moving in the same, the fluid moves in the same direction, you get equal input to your brain, and your brain says, okay, everything's cool. So the fluid, and then, so you get the bottom canal, when you turn your head, the fluid is swishing in that canal. You go this way, the fluid is swishing in these canals.
No,
You go
see,
this way,
I'm
and the
getting
fluid
these watching.
You better not get your grandkids there, because they do that all the time.
Yeah.
Now, this is going to be a really fun drawing.
Yeah.
But you've got like these 2 other structures that are kind of next door neighbors. Utricle and saccule, you don't need to know that. But basically, all of these canals, the fluid in the canals is also continuous with the fluid in these 2 adjacent structures. So they're next door neighbors. Now inside these adjacent structures, you've got like a big pad of jelly. And then on the jelly, they have little rocks stuck in the jelly. Because with the fluid in the canals, it only tells you when you're moving. But if I go here and stop, those canals aren't telling my brain anything. I'm still here, but the canals don't know it because I'm not moving. These know when I move positions and I stay there because that jelly substance with the rocks in it, the rocks pull the jelly in the direction of gravity. So those ones are telling my brain something different.
And it's usually only in one ear at a time, isn't it?
Usually, yeah. Call them rocks, call them crystals. If you Google it, they kind of refer to them. They're similar structures. What can happen since the fluid moves throughout all of these structures is that one of those little crystals or rocks can dislodge and it can go into one of your canals. So why is that bad?
Yeah.
To have a little crystal in your canal?
Oh, do they get stuck?
Fluid movement.
They get stuck and they restrict the fluid movement. They either slow it down or they block it. So what happens again, your brain likes your balance systems to agree with each other, otherwise it tends to freak out. So if you get rocks in one canal and not the other, all of a sudden you do that head movement, Karen, and this canal with the rocks in it is saying something different than this canal without rocks in it, and they're no longer agreeing. They're sending conflicting information to your brain. Your brain doesn't know what to do. You get the sensation of spinning. That's your positional vertigo.
How close are they to the cerebellum?
This is quite a bit different. This is like inner ear. Like if you could push, in right here, like probably an inch, you'd be on them. And they're small. They're little guys. They're right next to your hearing organs too. So that's your positional vertigo. Very treatable, by the way. Super treatable. So what we do then, we diagnose which ear it's on by a really fun test where we figure out which ear it is because you start spinning around and your eyes start going near. It's really interesting.
Yeah, I've
Really
had that. I've
interesting.
had that done.
Yeah, so like I can see it as the therapist. Like the eyes, especially if it's severe, the eyes will just go womp 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 womp.
Whoa, awful.
Oh, it's bad.
After I had a concussion, that happened.
Yeah, and actually that's a really common one. You have like a head injury, or like I had a guy that was playing racquetball and he crashed into the side of the wall. Boom, you dislodged some of those little crystals and popped him in.
But it won't go away.
They can go away, you just have to be rolled through it.
Okay.
Yeah.
Yeah.
Make it dizzy.
It's gone down.
That's right.
No, it's not.
Oh,
Luke,
it's not gone
Luke,
down?
in the old days,
I
I
still
mean,
have it.
talking about me, we used to say, you, what's wrong with you? Got rocks in your head.
Yeah.
Yeah.
Yeah, that's where it came from.
Rocks in the head.
Yeah.
Now I know
not
what we're
dry.
talking about.
I'm okay.
So again, positional vertigo is very
Lay
treatable.
down.
Very treatable. Because you figure out which ear is off,
Things that-
and
It's positional
you do a
now.
series of turns, and you roll those rocks through the canal and pop them back into where they belong.
And it
Then
works.
you just try to keep
Yeah,
it
you
stuck.
do exercises.
And it works very quickly, actually. That's one of the funnest things to treat because it's like instant. Usually you do it twice in a row, sometimes 3 times, because you might have a few little crystals in there. So yeah, it's very effective. There's different kinds of this depending on the canal, but again, very treatable.
But there's also exercises that you can do.
Yeah, afterwards you do the exercises. Once you take care of the crystals and put them back where they belong, then you have to realize that your 2 inner ears are out of tune. So you have to kind of fine tune them again, because this one's been telling your brain the wrong thing for a potential time period, and this one's still in tune. So you do some specific exercises to get them going. You do like a lot of those, or did you do this one a lot, where you shake your head and look at stuff? Yeah.
Oh, heavens.
Or stand on one foot with your eyes closed.
Yeah, that's
No.
fun stuff too.
That's not gonna happen.
Not today. Not today.
Not tomorrow either.
Okay.
Your jowls go back and forth.
And I mentioned this earlier, inner ear weakness is more common, mostly common. You know, again, just that unsteadiness, that's more of an inner ear weakness. And again, you do very similar exercises to fine tune it, to kind of buff it up. Which a lot of times if you wanted to buff up your inner ear, and you know there's 3 balance systems, you would take away the input from the other 2 and force your inner ear to do the work, right? So you might stand on a piece of foam, which is nice and squishy, which is kind of taking your second system out of it to a big extent, and then close your eyes, right?
Oh,
And you're like, oh my goodness, and you're working. Well, that's what you have to do.
Something real close to grab a hold of.
It's usually good to have a therapist around for that. Yeah. So that's how you end up working on these things. You pick and choose where your weaknesses are and you make them work. Because again, it's mostly like a muscle. Hasn't been used in a long time, so it gets weak, it's not responding. So just make it work, you know? Make it work, Jeannie.
7 days without exercise makes 1 week.
That's right.
Ah,
That's right.
Very good.
So that's the most common thing you'll see with inner ear vertigo. You know, it's positional vertigo. The other type of vertigo you're going to get is more related to your brain, and I kind of mentioned that already. That's like your strokes, your mini strokes, any of those neurological conditions like MS or Parkinson's that are going to directly affect your brain. So a much different strategy for those ones, like I mentioned earlier, because you're not necessarily hoping to change that. So what you do is you shift gears and say, well, we can't change that. Let's focus on these other 5 or 6 things that we can really maximize. You know, can you maximize your strength? Can you maximize your ability to use your sensation? You still have your inner ear. Can you maximize that? You know, and then to keep you safe, can you learn how to adjust your surroundings if you need to use a walker at times or this or that? Or if you know that when it gets dark, you're just in trouble. Well, plan ahead, stay active, but stay safe. Easy peasy. Easy peasy. Lemon squeezy. Other things you can get with inner ear problems is you can get like infections to your inner ear. Sometimes you can have like an adverse medication reaction. It's common with like certain antibiotics.
What
where
about
it'll-
sinus problems?
sinus pressure?
I have.
Yeah. Meniere's disease is another really common one. Anyone ever hear of Meniere's disease?
Yeah.
Meniere's, yeah.
We both have.
Ringing in the ears.
Yeah, we both have.
okay.
With Meniere's, what you get is they call them high drops. It's little like pockets of fluid, and as the fluid enlarges, it puts pressure on your inner ear, and so that's more longer lasting. That's more vertigo that you would just kind of get throughout the day. You don't feel like it's even positional. It doesn't really matter what you do, because the positional vertigo is mostly when you look down or up, or you turn your head too fast, or you go to get up and down from bed, or you roll over in bed. Those are the most common ones you're going to see. With something like Meniere's or something more related to your brain, it's just going to kind of be there, not going away.
Can
Doesn't
you
really
make that go
affect.
away?
Meniere's?
Yeah, because I can't. I've had that before. Suddenly I'm aware of the ringing in my ears, and if I just kind of focus, it just calms down.
Yeah, Meniere's is a weird one. It's one of those ones where there's a lot of like pharmaceutical options, and if you go online, there's a lot of natural options.
Yeah.
I think if you could figure out what was causing because years will come and go. If you can figure out what's really, ramping it up for you, you have a chance of treating it. So, yeah, it's a fun one. Go ahead,
So
Dallas.
what's happening when you yawn to pop your ears, and sometimes it'll do it and sometimes it won't? What's happening in the jaw and the ear combination?
That's more like your eardrum. You're just releasing pressure off your eardrum.
Oh,
So you've got your eardrum here, and then
okay.
you've got, the little bones that go back into your head, and then your
Right.
inner ear is back behind that. So
Okay.
not directly related to like your vertigo and stuff.
Okay.
But that's a good point, Dallas, is that you can have other issues like with your neck or the muscles around your
Yeah.
jaw and your neck, and that can certainly lead to vertigo as well.
Right.
Because what that does is it changes the pressure on the receptors in your muscles, and that can cause vertigo as well. And that actually kind of brings us full circle again, because balance really is affected by pain, because pain leads to all of these bad things, inactivity, tension through your neck and jaw. So all of these things can really feed off of each other, and that's why I keep coming back to that. You really have to know what you're dealing with, because your issues are different than hers,
Right.
and before, I can give, so like part of today's thing is I'll give you some advice on things you can do, but a big caveat to that is, if you don't know what you're dealing with, it's really hard to fix it.
Right.
You
What
know.
happens if your neck, and, in the spine and your skull,
Yeah.
it pops all the time,
Mhm.
and then if it doesn't, it'll stick until I'm like, oh my god, it just popped already.
Yeah.
So that's not normal either. If I'm laying in bed, I'm laying on this side, and then I go to move, and it'll pop, and I'm like,
Yeah.
is my head gonna fall off?
It might.
And I gotta hold it.
Does it hurt?
Yeah.
No, it doesn't hurt, but it pops. It
It's good that it doesn't hurt.
all the time. Well,
But-
it depends. Sometimes it does. Like if it gets stuck, and I'm like, and it does, especially when
It
I'm
gets stuck.
driving.
Oh,
And I'm
good.
like, oh, that's not good because I'm like, I can't turn my head till it pops.
What kind of car do you drive, Carrie?
Really?
Yeah.
Well, I mean, it's
No. What are you coming in for right now?
what's that?
What are you coming in for right now? If you don't mind me
Oh, for
violating
PT
HIPAA. Yeah.
or my neck and my back.
Okay.
And
Yeah.
my hip.
Yeah. Yeah.
But I don't understand
The
why
thing with the
it
neck
does
too,
that.
in relationship to balance, is just because you have neck pain doesn't mean it's affecting your balance, but it could. For some people it does. It's not a really common one, but if we go through and do like an examination and we test everything else, it's kind of like a diagnosis of exclusion. You say, well, your neck is really tight and painful with restricted motion. That could be the source of your vertigo or your unsteadiness.
Yeah, it's been doing that for a long time.
But you sound like you have positional vertigo.
Where's that position? Something alright.
Yeah.
I don't know. I don't
Positional
like it.
something. Okay, cool. So I've already, more questions on positional vertigo?
Excuse me.
All right,
Yeah.
don't fall out
I
there.
understand the PV. I wasn't listening to the BP. I understand PV, but what's the first BP?
She didn't say.
You don't need to know it.
It's a secret.
It's benign paroxysmal.
Oh.
Oh, that was
But-
blood pressure put something.
Yeah,
I
blood
know
pressure
blood
positional, no. It's benign paroxysmal. It doesn't really matter. I mean, it's benign, right? It's no big deal.
Okay.
I don't know who names these things, but it's positional vertigo,
Okay.
which again is vertigo with head movement.
Yeah.
Cool. Okay. Okay, I already probably given you the answer like 8 times today. What's the biggest mistake people make with trying to treat their vertigo?
They don't know the cause.
Boom! Susie, you win the prize. Actually, that's not quite the biggest mistake. Sorry.
So does that mean I have to give it back?
Don't eat that scone. It's a big one. They ignore it. We do this commonly, right, with anything that we don't like in our lives, whether it's vertigo or an issue with our spouse or whatever. You just ignore it, right? If you wait long enough, it'll go away, right? Yes, it will. No, no, your spouse. Yeah. If you ignore your spouse long enough, they will go away. Yeah. Did you use that once in your life?
I tried it.
Okay.
But some of us that you just learn to live with it.
Yeah. So
Yeah.
it is a mistake to ignore it and think that it will get better. You know, let's take a rule of thumb. If it hasn't gotten better like in a week, is it gonna get better on its own? If it hasn't gotten better in 2 months, is it gonna get better on its own? How about 6 months?
2 years?
2 years? Is it gonna get better on its own?
Exactly.
No.
it's not.
Yeah, it's not. What's the definition of insanity?
Doing the same thing over and over and expecting a different result.
Exactly. You were on it today. We talk a lot. So they ignore it.
That comes from Al-Anon.
Is it?
Eleanor?
Al-Anon, that's Alcoholics
Oh,
Anonymous, you know,
Oh,
people with
yeah.
alcohol.
Yeah.
The second mistake, of course, you just try to deal with it, or you try to alter it. You know, you just try to cover it up. Well, every time I do this, I don't feel so good, so I'm taking an anti-nausea medication. Okay, that's fine. It's a short-term solution, but you haven't changed that fact that you're nauseous. You're just masking it. It's kind of like painkillers, right? My back hurts, so I take hydrocodone every day. Well, okay, if that's the only option you have, I get it, but probably other options. So the solution then is to figure it out, right?
Right, figure it out.
And this goes to pretty much everything we do in physical therapy, not just balance, but you have to know.
Yeah.
Anybody ever read my blogs?
Yeah.
Humor me.
I've got
Do you guys hear me like rant about this? You must know the root cause of your pain, you must know the root cause of this or that. You know, you can take all the free advice you want, you can try to do what YouTube told you to do, but if you don't know what you're dealing with, your chance of success is really small. And with other stuff, you might even make it worse, you know, potentially. You're doing the wrong exercises. Oh, now you're in more pain, you know.
Yeah.
And again, with how much ground we've covered today with the 3 balance systems, things like medications, things like strength, flexibility, endurance, it's really easy to misdiagnose yourself with balance. It doesn't mean that everyone in here couldn't benefit from doing maybe some hip strengthening and some ankle strengthening if you have weakness. That's kind of a given, you know, if you have weak muscles and you can strengthen them, that's going to help, you know. But again, trying to do some exercises, not really knowing what you're going to do, it's a waste of time. Fair enough, Jeannie?
Perfect.
Fair enough. Okay, so if you discover the root cause, then you can develop a plan, you can get on with your life. And it doesn't mean that everything you have is going to be 100%. You know, and this is common with a lot of people we see in the clinic. You know, are you going to be back to feeling like you're 20 years old again and running around and doing handstands? Maybe not. But if you feel like you're getting to this point where you're losing mobility, you're losing independence, and potentially you're starting to feel the effects of the quality of life, you know, you're a little depressed, you know, you're not doing the things you want to do.
Sure.
You don't go to your grandkids' sports events anymore, you know, you avoid these events. Even just making, say, a 20 or 30% improvement can have a drastic impact on your life, you know. And for some people, you can get much better than 20 or 30 or 40% improvement. It just depends, again, on what you're dealing with and how much effort you're willing to put in. But again, you know, I talk to people, sorry to keep veering off course, I talk to a lot of people like this with like chronic back pain. You know, you're an 8 out of 10 pain. Are we trying to get you to a 1 out of 10 pain? No. I mean, I live in reality.
Not gonna happen.
You know, it's not. But if you can get your pain level down from an 8 to a 5, and you can bump your walking tolerance from 10 minutes to 40 minutes, what does that do for you?
A lot.
Yeah. And then look at the other side of the coin. What happens today if you're dealing with these issues and you don't take care of them at some point? Now, maybe everyone's sense of urgency is different. You know, I'm not that bad. And maybe someone over here is like, I'm really bad. If I don't take care of this now, like major decisions are coming my way. It's a good way to look at things too. What happens if you don't improve this? You know, what are you expecting to have happen? The activities that you're limiting right now are going to get more and more limited, and you're just not going to be as happy. So, I just love scaring people. Have I,
this
have I
winter-
frightened you, Elaine? Nah,
Nah.
she's fine.
She has all 3.
Does she? Yeah. Yeah. Yep, yep.
This winter has been really bad
It
for
has.
any activity to.
Definitely.
I mean, it's, you know, I used to go to the pool 3 times a week.
Yeah.
And,
Yeah.
oh man, these past couple, 3 months, yeah, these months, I just, you
Yeah.
know, the weather and,
Yeah, I know.
Well, and once
Yeah,
you get
and
into your
my-
50s and 60s and above, even like a reduction in your activity can lead to weakness so fast.
Yeah,
It's
yeah.
one of life's little tricks. Like you will bust your butt to gain strength, and
Yeah.
you'll lose it in about a week.
Yeah,
That's unfair.
It is.
yeah, I've been
But-
to, yeah.
I mean, you
I've
can work,
lost-
you can
I've
do
lost
aquatic,
so much.
you do aquatic exercises 3
Yeah.
times a week. I mean, and after probably 6 weeks, you're starting to say, wow, I feel pretty good. You skip like 1 or 2 weeks
I
and you're
know,
right back where
I
you
mean,
started.
it's just, yeah,
And nothing you can do about it, it's just your human
yeah,
physiology.
I just
So-
gotta build
so
back
the-
up again as soon
Yeah.
as I can.
Water aerobics, or
Yeah.
at least moving in the water,
Mhm.
is very definitely helpful for your balance.
Oh,
but-
yeah.
Mhm,
Yeah, so let's talk about then,
And all the
everyone
joints.
okay? Everyone have like 5 or 10 minutes left? If anyone needs to go, you can. Won't hurt my feelers.
Feelers.
What can you do about it then, right? Talk to Luke. Thank you, Jeannie. Seriously, we're gonna have to pay you to be here today. Yeah. So, you know, a lot of what we do for helping people with balance is in the clinic. But for some people, we kind of have to take a step backwards. I think, Carol, you've been in this boat before, where we start you with aquatics. Because basically, if you get into the fact that you have poor balance and you're looking at your balance systems and they're weakened, for a lot of people, they're so deconditioned and so weak, or they fatigue so quickly, or they have so much pain, or all of the above, that the pool makes a ton of sense. Because with the pool, first off, I mean, depending on how deep you go, you're unweighting your body. So for those of you like knee pain, hip pain, low back pain, all three, it's much easier on your body.
Absolutely.
And you look at the pool as a stepping stone. You know, you can't live your life in the water, you know.
Oh, yes.
But you can keep working out. Yeah, you may like to. You're not going to turn into a mermaid, though. But it's a huge stepping stone. And for some people, it's something that you can continue to do on your own because you feel like you can
Yeah,
get
I
so much more done. You know, you can work your legs and you can work your balance, and you take away that fear of falling too, because you're working in the water. I mean, the worst thing that happens if you fall over in the water is, you know, maybe you dumped your head under and you pop back up. Hopefully, people don't fall in the water though. I always think they're going to, like when they're walking
it's even
around,
support on
they
your
don't ever
body.
tip over.
Don't you
Yeah.
think it's even support all around your body?
Yeah, it's a weird type of support though,
Yeah.
because with the water, yeah, if you start to go over, you just
And for
keep
me,
going.
it's
Yeah.
social too, so many of us have been going together
Yeah.
for so long.
Yeah, so that's a big stepping stone. So, you know, there's a lot of things you can do, and again, like I said, if you want to look at generic advice, if you have weakness in your ankles, if you have tight ankles, stretching is good for you. Strengthening your ankles, especially your ability to push up onto your toes, is really valuable. Hip and core weakness is probably the biggest bang for your buck. You know, any type of hip strengthening you can do will really go far, because a lot of your balance strategies, which we didn't really cover, go through your hips and your core for your bigger corrections and movement. So that's all good stuff. And again, for most people, I think if you really have a few underlying issues, it does help to work with a physical therapist. Put my own plug in here, of course, right? So those are two good options. So if you know that you have significant issues with your balance, you know it's going to impact your quality of life. It already is, and it's going to get worse. You can talk to us, and you know we'll get you a physical therapy evaluation. If you feel like, yes, this is, I can't spell. Evacuation. Yeah. Been hanging out with Stephanie for too long. You know, we can definitely set you up, get you on a plan, help you understand what you're dealing with, and map it out for you. For some people, you say, you know, I'm just not sure, I'm on the fence. I'm not even sure what I'm dealing with. I'm not even sure if you guys can help me. That's a very valid concern. So before diving into like a formal evaluation, we can do what's called a discovery visit. And this is something that we offer to people like you guys who come in, and obviously you have an interest in what we're talking about. You've come in on a nice Saturday morning and spent some time with me and listened to me tell weird stories and stuff. So we do a discovery visit. This is a free 30-minute consultation with one of our physical therapists. So again, if you're not quite sure what you're dealing with or if we can even help you, which again I think is a legitimate concern, you want to know what you're dealing with. Or if you say, I don't know what the obligation is going to be. Is it going to be, how much time is it going to take me? What can I expect? What does my insurance cover? What's my out-of-pocket costs? Those are things that we like to be really upfront with people, especially nowadays when the cost of your care is rising, you know, on a monthly basis.
So this discovery visit could be a way to pinpoint your balance systems, which one needs work.
Yep. So that's exactly what we do. So there's kind of two things we do at a discovery visit. We help you understand what you're dealing with, what's the root cause, and then we talk to you about if we're the right people to help you. And once in a while, we're not the right people to help you. Once in a while, you've got something a little more brain involved, and you need to go see someone else besides us. You need to go see your primary care. You need to go see an ear, nose, and throat doc and have some more testing. So again, it's a nice way to kind of test the waters. You know, if you're not quite sure if it's a good fit for you or if we're going to be able to help you, it's a great option for people. And we actually try to steer people towards these a lot, even people who call us nowadays with a referral, because again, we want to just slow things down and make sure people understand that we're not just trying to rush you in, you know, and sign you up. You know, we want to make sure we're the right fit for you too.
Stephanie likes to rush us.
Well, she knows you.
There.
She knows you and she likes you. All right. Off to your next one? Okay. Good, we'll talk to you soon, Susie.
We don't get a song.
I can get that, Susie.
No song, Susie.
Oh, no, I don't know any songs.
Oh, I've been to her
I
concert.
could sing when I'm 64. Would you like to hear
Oh, I
that?
love that song.
Yeah, well, it's not me.
Thank you.
Good, all right. Any questions about these two options?
very helpful.
Okay, great. I'll talk to you soon, Susie. Cool. So, for those of you who are leaning towards one of these, you can talk to Stephanie at the end here. She's got, I think, 5 or 6 spots open next week between the PTs that we can help you out with.
I see.
There we go. Any questions?
Very informative, thank you.
Yeah.
Thanks, Luke.
Did I cover most of what people wanted to?
Educated now.
Educated?
Yeah.
Good. Now you're a dangerous person.
I know.
You're informed. Yeah. Any other questions over here? Okay, yeah. Yeah, positional vertigo, it's pretty cool.
I don't know
Yeah.
about the one.
Good. Gloria, did we get all your questions answered?
I guess one of the things I'd like to know, this is kind of a Fogler joke too, is what kind of things can you do to prevent the fall?
It just basically goes back to finding out what's leading to your balance issues and working the things that can be worked. So for a lot of people, it's saying, okay, we can improve the function of your inner ear, that third balance system. We can make you less reliant on your vision. And if you've got weakness in your ankles, weakness in your hips, weakness in your core, we can improve all of that. Yeah. And the thing I'll say about balance too, and especially strength related to balance, and again, the older we get, the longer it takes to build strength. It's, for a lot of people, we can tune up your inner ear rather quickly. You know, within a week or two, you can start to feel the effects of the exercises you're doing. Strength will take you a little longer to get traction. Strength will take you several weeks to just start feeling stronger. And then it'll take some diligence to actually get stronger. And again, just one of life's little, nice little tricks, I guess, but
Gotta work on it.
yeah. And again, if you're not sure, again, if this is something you're ready to, you know, you're ready to kind of dive into, then, you know, Discovery Bits is perfect for you because we can talk to you about you specifically. We can tell you what you're dealing with, and we can give you an idea of what it's going to take for you to achieve your goals. And for some people, that's reasonable, and for some people, it's not the right timing. So,
I've learned as this has gotten worse, to move slower,
Absolutely.
to not be in such a big hurry.
yeah. That's a good lesson for life in general, though, right?
You know, it's like when I do get up from a chair, I have to stand there for a few minutes until I know my head's clear and I can go ahead and move. But, you know, that's about the only thing I've learned, you know, in terms of how to do it.
Yeah. And so that's a good strategy for now, and it would make a lot of sense to figure out why you have to wait that long. You know, and it could be a blood pressure issue. It could be,
Probably.
you know, do you feel lightheaded? Is that why you can't move, or is the room kind of moving around?
It's just the unsureness. I think that's the word.
Yeah.
But, you know, once I get on my feet, I've got to wait until I make sure where they are.
Yeah.
My feet have to be able, that sounds silly, but I
No.
have to know where my feet are so I can move.
Yeah. Very likely you could improve that. Very likely. Yeah. Go ahead.
Okay. My question, I guess, is, okay, I have feet and ankles that, well, knees, I got arthritis all over, but the feet, because of the neuropathy, is kind of like walking on blocks. I don't walk in shoes real well. I can go in my slippers, they've got a hard sole on the bottom, but I can do that around the house because I guess they fit the foot better. And my ankles don't bend like they should or move. Anyway, when you do the exercise and all, do you ever get to that point where when you do get up from a chair or something that you can go, you don't have to stand there and wait to find out if your feet and your ankles are going to take the step without falling? That's
Yeah. So again, it kind of depends on if that's just a neuropathy thing, or if it's another issue related to like just feeling unsteady in general, which is kind of
Okay.
two a little slightly different things. And the other thing that you mentioned was your footwear. You know,
Yeah.
part of that's going to be affected by your footwear. We happen to have a foot doctor in the back of the room, by the way. This is Dr. Clark, everybody. Footwear is big for neuropathy, though. You know, so you talk about they've got diabetic
Yeah.
shoes, you know, different types of shoes that just make you feel, and especially if pain is a factor with that.
Oh, yeah, I wear it.
But again, so that's one, that's one thing to consider. The other thing to consider is that more just the feeling of unsteadiness. You're not sure if your body's responding, or you're not sure if your brain is responding, so you just have to like wait.
okay. I think it's more that the feet and the ankles are just so stiff. I don't know whether I can take a step and not fall or something.
Take a test
Yeah.
step.
And again, like you said, if they're real stiff, and a lot of times ankle weakness is a really strong predictor of falls too.
Yeah.
So tightness in your ankles and weakness in your ankles, direct relation to falls. Yeah. So again, there's so many factors. You just gotta go through, do a very detailed examination, and figure out which ones are the major factors for you. Because not everyone in here has tight ankles necessarily. But if you're walking slowly, I can say with pretty good confidence that you have tightness in your ankles and you have weakness in your
I have
ankles. You have tight ankles by now. Because if you take short steps all the time, not much movement in your ankles. And if you take short steps all the time, there's not much strength in your ankles either, because you're not challenging them. So again, strong predictor of falls is your ankles.
Well, I have to stop and think about, you know, it's like you say you're taking small steps, and when I'm doing that, all of a sudden I realize I am, and I have to think about increasing the length of
Yeah.
my step.
Yep.
Yeah.
And again, for someone who isn't comfortable doing that, it's probably a safe strategy that you're taking the short steps.
Mhm.
And it would be potentially a big mistake if you said, well, Luke said long steps are better, and you start taking long steps. Because that's the hardest thing with balance, is for you to challenge it adequately, you run the risk of falling. Which is why we see so many people with balance. And again, that's one of the positive things is using the pool as a stepping stone, is you can start to work on that without the fear of falling. You know, and you can do that with a therapist in a clinic too, but
Now, I find myself shuffling.
yeah.
My friend will say, "What that?"
Yeah. Okay, good. If anyone has more specific questions, I'll just hang out for a little while. Stephanie's hanging out. If you want to talk to her about a discovery visit or anything like that. And then I got a lot of those breads and cookies over there, so feel free to take one home. So, all right.
Thank
All right.
Thank you all for
Thank
coming.
you, Lou.
Yeah, it's good to see you all.
It was a good class.
All right.